Greetings, Fakeeh family members. I wish you well, you and your loved ones, in this testing time. We need to put things in perspective. The current epidemic has not really reached alarming proportions in Saudi Arabia. The number of cases is limited, and most of the cases have had travel contact. Either they themselves have traveled or they have been in contact with someone who traveled. Having said that, we must prepare for worst case scenario. And worst case scenario, the disease is not a severe disease. Fortunately, the mortality rate is quite low. Most of the patients will have mild symptoms and will recover uneventfully. Some of the cases would need hospitalization and care, and unfortunately, a very few number of cases would succumb and die. But most of the deaths have affected people with comorbidities, old age, immune suppression. So the large majority of people would not have any reason to fear or be apprehensive about the disease. As I said, we need to be calm, we need to be cautious, and we need to practice good infection control measures. From a leadership perspective, we have formulated a task force to address aspects of managing the epidemic, address aspect of worst case scenarios. So we have reviewed all infection control measures, made sure that the supplies are available, the medications are available. We put measures to control the access to the organization. There were other measures related to financial readiness, measures related to human capital management, including leaves and sick leaves to certain groups of vulnerable staff. Having said that, we as a healthcare organization, we are at the forefront of fighting the disease. So it's not the time for us to hide, it's the time for us to fight and to be vigilant and to be present. And if we practice proper infection control measures, we will be safe as well. I'd like to remind you all that this hospital discovered MERS-CoV. The first case that diagnosed worldwide was diagnosed in this hospital. More than 100 staff came in contact with that patient back then in 2012. And because of good infection control, none of our staff got infected or even seroconverted, just by taking good infection control precautions, hand hygiene, and protective equipment. So if you practice proper infection control, God willing, you will all be safe. I'd like to end by thanking you all for your dedication, your hard work. You're the unsung heroes facing disease, facing risk for infection, but this is why we entered this field, is to help people and support people in their time of need. Thank you very much, and God bless.